Kia ora, I'm Chris and I work in the Partners in Care program at the Commission, which is really all about consumer engagement. So it's all about you people out there, which is really, really important. We recognise at the Commission that having input from people who are affected by the services that are delivered to them is critical to improving those services. So with this program, we've been working hard on that for the last 5 or 6 years, fantastically with staff and also with patients and consumers. And so we've got a whole program that works around consumer engagement, and we've got heaps of consumers that work on the consumer programs and attend the meetings, work with the expert advisory groups and have that critical input that we need to understand what's happening for people out there who are receiving the services. We also have a consumer network, and they help with the strategic side of things at the Commission, so advising us on strategically, what's important, how can we get more buy-in, how can we just make things work, faster and stronger for getting that consumer input. So that consumer network meets 4 times a year, and there's a lot of information on our website. Anything you want to know about consumer engagement, just come to us.
I'm Deon. I also work on the Partners in Care program, which is the Commission's consumer engagement program. Really for us, over the next few years, we have 3 really important areas of focus. One of those is about responding to the patient experience of the health and disability system. One is about really promoting those consumer provider partnerships. And the third one is really about building leadership and capability. So building up all the consumers out there to be able to really provide good leadership and good decisions at all levels of the health and disability system. So responding to the patient experience is really looking at what are people saying out there about what it's like to experience our health and disability system, and what can we do in response to not only make the patient experience better, but to also improve the overall quality of the system. So that's one really important focus for us. The next focus is about working with consumers to really co-design services. So first of all, ensuring that there is representation, that there's representation at all levels of the system, whether that be policy, whether that be governance, or whether that be, say, for instance, on a consumer council, but also making sure that systems and all services are co-designed, are truly co-designed. And finally, building consumer leadership and capability. So no matter what part of the system we're working in, we always ensure that we have strong consumer leadership.